Hey, howdy and happy day. Healthcare. Healthcare is a cry you hear around the world, everybody. Every politician says, let's have free healthcare. They're doing that everywhere. I mean, why? There ain't nothing free. There's no such thing as a free lunch, but these people keep on. And what's interesting is so many countries use Canada as a model. They say Canada has free healthcare. In America, so many Americans say, you guys up there, you people, you have free health care. Aren't you lucky? And I always explain to them, I say, excuse me, who pays the doctors and who pays for the hospitals? And you really think it's free? The taxes are so big. Big taxes because of health care and so many other socialized things in Canada. But hey, let's kind of go deep into the pool here with regard to Canada and talk about their free health care. Firstly, it's totally dysfunctional. It doesn't work. It hasn't worked from the very beginning. So it's a federal program, but yet somehow each province also is involved in it. They have their own program. It's mixed up like a dog's breakfast. Again, free, isn't it great? I guess if you don't know any better, and that would be someone who wants a checkup and you phone the doctor and you get an appointment and you go and it's free. It ends there though, because if you need something done, good luck. Let me give you some examples. Free healthcare. Okay, like in Quebec, let's go through all of the provinces. In Quebec, if you want a knee replacement, there's a 519-day wait. 519. Do that math. Calculate that into months and years. That's extraordinary. It is unbelievable. In Saskatchewan, it's for, let me see, a knee replacement, 622 days. 622 days. Like that's almost 2 bloody years. In Alberta, it's 645, 574 in Manitoba for a cataract surgery. A knee replacement in Nova Scotia is 595. Newfoundland and Labrador, knee replacement, 464 days. That's how long you have to wait. And if you're 80 years old and you have to wait, your best before date's already up anyway. And now what? Well, what happened? Let's kind of keep going here. Then you have a hip replacement in Prince Edward Island, 540 days. 540 days. New Brunswick, 550 for a knee replacement. And knee replacements in Ontario and British Columbia, 349 and 439 days respectively. Wow. So a year to 2 years. It's totally incredible. And when you get there, if you miss your appointment because you have COVID, you have a cold, they're kind of the same thing. Hey, but whatever. I mean, then you have to wait another year or two. And by the way, every politician in Canada, as far as I can tell at least, has gone at one time, or certainly will if they haven't already, and will again, to the U.S. for health care. They have an issue, so they go there. So many Canadians do. You're not allowed in Canada to have the private system because that's not fair. You know, socialism is a terrible thing. I mean, I don't believe in government control on anything. Certainly not in the healthcare. It should be privatized. People in Canada say the U.S. is terrible, and I always say it is. That's not true. It's just not true. It's cheaper when you factor in the taxes. And when was the last time you heard of a person going into the operating room dying, and the doctor looks at him and says, "Do you have insurance?" "I do not." Take him out to the lobby, and he can die there. Doesn't happen. There's a law. There's a law that they have to be treated in hospitals. They don't die like that. It's a great system, and it should be allowed to get better. Go back now to Canada. It's a terrible system, and it's being allowed to get worse all of the time. Hurry up and wait. I mean, it's incredible. They don't have private clinics anymore, as I said. In most places, how do you fix it? You privatize it. A socialist government, if you can't even do health care, you're really screwed up. I mean, good grief. Again, I'm against it, but let's just analyze this. If you really are a socialist, can't you do it properly? I mean, the first order of business should be to look after your citizenry. There should be an MRI machine at every block. They should have them in 7-Eleven stores. You should have machines everywhere. They don't have them. What do they do with the money? They give it to homosexual groups and transgender groups in India and in Bangladesh. They go everywhere. The government's nuts. And again, if you're really a commie, a pinko, for heaven's sakes, act like one and fix the healthcare system. Bottom line is it shouldn't be government anyway. It should be privatized because it would work better. But when you have to make an appointment to see a doctor, and by the way, before you get to that 400 or 500 day wait, you have to go through the channels. You have to go to a doctor who in turn has to refer you to a doctor who is a knee specialist, and then he in turn puts you on a waiting list. So when I say the list says 400 days. That's not true. It's more like 500 days. And when I say 5, it's more like 600 days. That's not good. Your health is paramount. You should have the ability to go to a private clinic and look after yourself. And again, the bottom line is free. It's not free. Compared to America, it's twice the price. Twice the price. Because to pay for the doctors and all the hospitals and all the things that aren't there for you comes from taxes. I wish I could drill that into people's heads. Think about that, will you? Y'all thinking now? I mean, no matter what country you're in, when you're watching this, think about it. I mean, private stuff works. Government, it's interference. They couldn't manage a 2-person barbecue with 4 people. I mean, it's awful. Hey, y'all get better if you're sick. And good luck. Tell the government to get that bloody heck out of business, will you? Get a man on that. See ya.